Eugene Brailovsky and Mike Gibson coming to you live from HRS, and we're talking about amyloid, conduction disease, and atrial fibrillation, and outcomes in the ATTRibute-CM trial. Eugene, talk to us a little bit about what you found.
Thank you so much, Dr. Gibson, for having me and for being able to present. This is interesting data that we analyzed from a Tribute-CM study. As you know, a Tribute-CM was a pivotal phase 3 trial of acoramidis versus placebo in patients with the ATTR-CM across the whole spectrum of disease. And to remind the listeners that a Tribute-CM showed that acoramidis was much better than placebo in reducing hospitalizations and all-cause mortality. In this post-hoc analysis, we looked at patients with EKGs and other parameters looking at conduction disease progression. And what we found that for patients who were able to look at their ECGs who were not paced at baseline, their PRR interval and QRS duration interval was not as progressed for patients with acoramidis as compared to placebo.
And that is a very sensitive measurement. Was there any difference in clinical outcomes?
Correct. So this is a very sensitive marker of looking at disease progression. And in terms of clinical progression, we looked at patients with and without AF at baseline, and we found that for patients receiving acoramidis versus placebo, the outcomes were much better regardless of the AF status at baseline.
Well, so very consistent results with AF or no AF at baseline, and for a very sensitive marker, less PR prolongation, less QRS prolongation. Eugene, thanks so much for sharing with us.
Thank you so much. We hope that this informs future trials in patients with ATTR-CM and leads to even more clinically relevant markers of disease progression.
Great, I agree. Thanks, Eugene. And thanks to all of
Thank you
you for
so much.
joining us out there.